Hello, DAs. Today we are going to be focusing on Chapter 29, Pediatric Dentistry. This is going to be a good chapter for all of my students that are interested in pediatric. So please take notes and listen closely. Okay, so your pediatric dentistry deals with children and patients with special needs. Sometimes you'll hear, your doctor or people and assistants from that field call it PEDS. That's just a short term for pediatric. It could be PEDS or pedo. So the pediatric dentistry, helps high-risk preschool children. The program focuses on prevention and restorative dental care for children, and especially the ones that are eligible for Medicaid between the ages of pretty much birth to the age of 6. The program helps promote positive dental behavior for an early age child. Therefore, this will prevent any bad behavior. It can help reduce bad behavior and to help the patient, which would be the child, have a positive dental experience. Now, your pediatric office generally is going to be designed to focus on making it a child-friendly atmosphere. Of course, you're going to have your pediatric dentist, which is specially trained in, child's growth, development, and they specialize in behavior management. Okay. They also treat children from birth, and that's around the age when teeth begin to erupt, and so forth when they get into their ones and twos when the second molars come in. So when I say ones and twos, this is anywhere from birth to the age of 6. Pediatric dentists sometimes have to treat adults, and that's your special need adults that, we want to be able to sedate them in a positive way. Um, Special needs, ADHD, they may be on a wheelchair, things of that nature. Now, your receptionist area in your dental office will be tailored, of course, for a child. They may have coloring books, they may have reading material, toys, and each day you're going to have to go and sterilize the toys, the books, just to prevent germs from carrying on in the office. So it's going to be it's going to accommodate the children. Now, the pediatric office is staffed in the same manner as a general dental office. The staff needs to pretty much enjoy working and interacting with children. This is a field, if you cannot, one, be happy on the job and have patience to deal with children, I don't advise you to go into pediatric. So, looking, the looks of the staff gear, you're pretty much going to wear, of course, a scrub, but it could be something comfortable because you're going to be, bending over children, bending over the chairs, maybe picking them up, things of that nature. So it could be a cartoon character scrub, whatever the office requires you to wear. You will also wear, it could be bright colors, some type of cartoon character, things of that nature. Um, Something that the children is gonna like. I think children are into Peppa Pig and Paw Patrol and you know, things of that nature. Now, let's talk about your role as a dental assistant. It could, you have a lot of roles. Now, depending on the office and the state of employment requirements, one of your responsibilities as a dental assistant in pediatric is going to be to put the child at ease and manage the child. And when I say manage, I don't mean being disrespectful or jerking the kid or um, slapping or hitting the kid. No, meaning managing the child as far as keeping them entertained, letting them know that it's okay, putting the TV on, give them a coloring book, just go along with the child. The dental assistant will also assist with, like I said, playing a part in informing and educating children, and also, helping the patient meaning the child, the parent, to feel comfortable enough to trust you to be in the room alone with the child. And sometimes parents they want to come along to make sure that everything is okay. But I feel like once you build that solid foundation, that trust with that patient, they're going to be comfortable enough to let their kid go to the back with you without them being present. Now let's talk a little bit about behavior levels. A child between the ages of 2 and 6, that is the most challenging times of a child. And, you're going to have to, go through a few challenges to manage their behavior. Sometimes the parents can be a big help, and then sometimes they make the situation worse. At this age, the child could be, is able to pretty much follow instructions and tolerate some dislikes. Also, just giving the child an explanation could be simple. Explanation meaning that, okay, we're going to walk to the back. I'm going to sit you in the big cool chair, and I'm going to give you a fluffy blanket with a stuffed animal, and we're going to put your favorite TV show on. If your office has TVs in their rooms. And most of the time when you're dealing with children, um, you know, they're going to enjoy the fact that you have TV. Also, just showing feelings and that you care, and face expressions will really help, um, be helpful and help the child relax. So make sure in your book you go ahead and highlight these bullet points. This will help you for your exam. Well, not for, but with. Now your ages between 6 and 12. This age group is a lot less difficult to manage. They're aware of the place where they're at, and sometimes you to go back to the birth to 6 years old. Sometimes if you just educate the parent on how to prepare that patient to come in. So when I say help prepare the patient, a few days before going to the dentist office, you want to start explaining to the children, where they're going, what the experience is going to be like. We're going to go to the dentist, and, it's going to be fine. Mommy's going to be with you. We're going to just brush our teeth. We're going to say cheese. Just start telling them where they're going before, prior to going to the dentist, because that can help out a whole lot. But when you get into the ages of 6 and 12, they're more independent. They understand. They're more aware of, the place of where they're going. They're aware of, like, hey, if I'm not brushing my teeth properly, I don't want to get picked on at school. So just increasing the importance of proper hygiene is great for this age group. Also, at this age, I can remember not wanting to have stinky breath or go to class with all kind of gunk on my teeth, things like that. Now, patient management, that is, you know, a lot in itself. And you can use this in all dentistry fields. This will help you become a very swell dental assistant, and your patient is going to appreciate it. Your doctor is going to appreciate it. Um, this will take you a long ways. Remember, I tell you guys all the time to make sure when you're in the office, have tough skin. You don't have to take your emotions out of um, when your patients are being ugly. And if you sometimes if you, shine your positivity on someone, that may make them, check themselves internal and say, if this person can be positive, then I need to be a little bit more positive. But, patient management, there's a large variety of techniques you could actually use as a dental assistant to engage with your patients, and just keeping control of the patient in pediatrics. You know, tell, show, uh, you know, there's a phrase called tell, show, do. And what that means is it's a method that you use, to demonstrate and explain to the child before you actually treat the patient. So tell, show, do is a very positive method. I want you to go ahead and highlight that in your book. Also, just, tell, show, do explains a lot to, help your patients, especially when you're dealing with children. Speaking calmly and firmly shows a child, hey, who's in control. Also, it shows a child who's in charge in the situation. So you keep a calm voice and you be firm. I think that goes a lot ways. That goes a lot ways, not just dealing with your patient, but just in life in general. Now, also allowing the child to watch videos and listen to music, or even getting the child to think of something pleasant. When I say think of something pleasant, just a distraction from that you can actually give the child to um, just not even think about the procedure that they're going through. Now, at the end of the day, the child will read your facial expressions, your body language as a dental assistant. So, this is a field where you absolutely have to be just happy every day. And nothing's wrong with being happy. Doesn't it feel good to be happy? Also, the children that's able to see your behavior, and it even works with children. If they're able to see that you're being positive and you are being caring, that will definitely enhance their behavior to be on the good side. One more thing, positive reinforcement, just lets the child know what that they're doing things correctly. You want to encourage the child. You want to just, spruce their spirit. Now, it may be times when, we can't prevent injuries sometimes. And the procedure may require us to restrain the child. With some type of limitations, even your children with disabilities, they may, um, they may want to move their arm, kick their legs. We have to get in control of that. You want to let the child know that this is not okay. This is not how we act when we come to the dentist, but it's okay to be scared. It's not okay to fight. You as a dental assistant, it's not okay to fight the um, doctor. And sometimes the dentist may step in at this point and say, okay, you know, the dentist may calmly place, his or her hand over the child's mouth to gain that child's attention. Also, will calmly communicate with the child. Um, just the dentist may, interact with the child. The dentist may also want to allow the child to understand who's in control here. Um, you know, that can kind of get sticky with the parent, but, um, I've seen children bite dentists, pretty much draw blood in the patient's from the dentist's hand. It's a lot. And if you would ever get, bitten by any human, you need to get a tetanus shot, because the mouth is very dirty. You don't want to catch any infections behind your patients. And when I say a bite, meaning that they have to actually break through the skin, draw blood, things like that. Now, it gets a little bit more difficult when we have to talk about, giving sedation to the patient, because, we have to give a shot to restore, um, any restorations on the patient or extractions. So, sedation may be required, um, to reduce the child anxiety, reduce the movement, and overall protect the child during the procedure, and also protect you most of all. Now, let's get into a little bit more of tell, show, and do. I want you to write a list of tell, shows, and do's. You can kind of see in the picture here, and this is in your book, how the assistant is actually showing the patient, okay, this is my air water syringe. All it does is squirt water and air, and if you squirt it together, it'll make the water have a little pressure. Just explain to them. Show them what the suction does. The suction, okay, let's put it in your mouth. And it just pretty much sucks all the saliva, all the spit. You can even use little terms with children so they can understand. Now, your patients with special needs, of course, you're going to have to approach that in a different way. You're going to have to consider what is the patient's, how physical they can be, what level the development is, what's their emotional state. They have a behavior issue. Any impairments could limit them, to sit in the dental assistant chair. I'm sorry, the patient chair. And we definitely have to manage the medical records and, get approval on any procedures we would actually do on the patient. This will actually help us in the long run. And sometimes you have all these patients at one time, and most of the time they're sent, to be sedated so that we can clean their teeth, or we can do that restoration that they wouldn't let general dentistry do. Now, once again, um, let's talk a little bit again about how to um, prepare the patient. So patients should be prepared and educated, um, and they don't walk in educated, but when they leave, they are going to have some type of education from us. Okay. Um, the best ages, is 2 to 6. You want to definitely schedule before a problem occurs. You want to let the children watch other family members receive treatment, meaning that if you have a patient or a family that comes in and they have little older kids, you want to let the older kids go first and let the little one watch you treat the older kid. And you want to remind the big sister, big brother, like, hey, I need you to be a big girl because your little sister, your little brother is watching you, and I need you to behave so that, your little sister or little brother can see that I'm not here to hurt you. And this would be a good moment to do the tell, show, and do method. Here's a dental check. I will be posting this question. So make sure you are writing this question down and you're taking notes. But it says, what may motivate preteens and teenagers to maintain their teeth? Here it talks about, honor roll of a dental, a star patient. Um, and I will be posting this on Edmodo. Now let's talk about the preventive procedures. We know anytime we see the word preventive, that means it's a method that we use in dentistry to prevent patients from having cavities or breaking their denture or breaking a bracket. Restorative and preventive are two different things, but let's talk a little bit about that. So there are several procedures that are common in pediatric dentistry. The most common one for children that needs just a little bit more help is a preventive procedure, such as teaching them oral hygiene techniques. That is, also polishing the teeth, whether it be polishing the pits or the fissures, seating sealants to prevent the children from having cavities. And most of all, we do this in the dental office at not dental office, but dental lab at school, where we practice fluoride treatments. And we know fluoride treatment is pretty much a gel that we put on the teeth, and it just helps prevent any cavities, and it's nurturing the teeth to help them strong and stay strong. Now, the mouth also, mouth guards and appliances can be used to protect children that are involved in physical activities such as sports. Also, they may even help them prevent them from any high risk injuries, and also help them not lose any teeth prematurely. The appliances can help maintain and correct position the teeth until permanent teeth erupt. Now let's talk about sealants so you can have a better understanding of what sealants is. I did post a few videos on sealants to see how they are actually put on the teeth, but the benefits from sealing teeth helps prevent cavities, especially on newly erupt teeth. We would not put any sealants on baby teeth. We would only put them on the molars, the permanent molars that the children receive, and this just to prevent any sugary things or anything from seating in the, not cracks, but the deep grooves in each tooth. Okay. It also it's cost efficient and it's painless, so they don't need any anesthesia or anything to receive sealants, and they last a very long time. We don't want the patient to um, chew on hard things, but it lasts a very long time. Here we know that the fluoride treatment is pretty much used to anytime we're doing any prophylaxis, and that's just to help the teeth remain strong, and as I said before, just protect them from cavities, and protect the enamel, which is very important on the tooth. Also, let's talk a little bit about mouth guards. Mouth guards can be custom fit to make, to fit the mouth, where the dentist actually will take impressions, and um, the mouth guard will seat properly. Um, just as the teeth are shaped in the mouth, it will, snap on like a glove. It is expensive, but you will always get a better fit when you get a customized mouth guard. Also, you have your mouth guards that you can go to academy and get, like your football players. You take it, you ball it in some water, and you bite into it. Um, you know, and that works for some patients. I'm sorry if you're hearing any noise in the background. They're doing some construction behind my house, and just bear with me. Now, your space maintainers. Yes, and I will be posting a video on what exactly is a space maintainer. It's actually used to um, maintain the space for your permanent tooth to erupt. Now, sometimes children they need to pull a tooth that could possibly have major decay, and the doctor will have to pull that tooth and then turn around and place the space maintainer, and it's just like a little paper clip. It attaches to one teeth, and it presses against the distal of the tooth in front of that teeth, and it maintains that space for the permanent tooth to erupt. All right, restorations. We talk all the time about restorations. They can be big, small. We have amalgams, for posterior teeth, composites for anterior teeth, and also stainless steel crowns for major decay, things to that nature. Here we have where we talk a lot about this all the time when we're on the crown and bridge tray, and you have your stainless steel crowns. Your stainless steel crowns is used both primarily and on permanent teeth. Also, they may be placed on permanent teeth on children until they are old enough to receive any gold or porcelain um, crowns. Now, your vital poke therapy, you know, it says care, here, care is very important. It must be taken, to access the child's pulp in the tooth, and it's almost like a root canal, therapy treatment. Sometimes the children have to get that, and it's a form of one. Um, Placing medicine inside of the canal, removing any decay, and just trying to maintain that area, for the patient or that tooth. We already talked about the therapy. Make sure you're highlighting the direct pulp cap. That's another method of removing carriers. Now, if you get into your phlebotomies, that's where we're removing, of course, the nerve and using methods as we would for a root canal. I will be posting videos on each one um, to help you get a better idea of what's a phlebotomy, indirect pulp cap, and it's exactly what it's saying on here. It's just where a cap is used, of course, to protect the tooth, but where we actually remove the decay and put some calcium hydroxide inside of the tooth until that patient can possibly get a root canal. I will be posting videos on indirect pulp cap. Here it shows you an example of removing, prepping a tooth, by removing and placing medicine. Make sure you're highlighting these different steps in your book. And this is also helping you get an idea of, cleaning the decay out, placing, medicine inside of the tooth. It's just a whole process. I will be posting this dental check on Edmodo, so make sure you get your information to be able to answer that question. Emergency treatments that comes in place all the time. Children are active, they have accidents. Common injuries would be like a fractured tooth from falling, displacement, things to that nature. I will be posting videos on, a fracture tooth if it was on anterior teeth. Um, Sometimes, when they're small, we're going to have, they may walk around with a silver cap or a fake tooth till they're old enough to get a permanent crown. Um, but, we have to still treat them as a regular patient. The x-rays we're going to take is going to be used to determine how we're going to proceed with the procedure. We're definitely going to test the pulp. And, the pulp, may be done to determine if the tooth is still vital. Sometimes you'll see little children walking around with like a gray front tooth, and they probably fell, or hit them out. And that's just saying that the pulp and everything is dead inside of that tooth. Children teeth are not as sensitive as permanent teeth, so they could live with it until it actually sheds, fall out. Now here is just showing you a picture of possibly trauma. Um, and this could possibly be, a patient where the anterior tooth is finally erupting or re-erupting, things to this nature. The tooth should, be allowed to have their time that's planned for it to actually erupt, but the teeth can be repositioned, and also just trying to maintain its position. It could be damaged, and that could determine once the permanent tooth erupts. So we may not know what type of trauma, if a child, fell. Um, they may require to do a endo retreatment. The permanent tooth could have possibly be pushed back, and we may have to extract a tooth for it to come out. Things like that. Now here, if a child would fall down and their tooth would pretty much fly out, you want to try to keep that tooth in some type of moisture, meaning, whether you take the child's spit or blood or whatever it is, and you want to immediately replace it in the socket. This method is one of the quick, highly recommended um, techniques to do, especially for any of my parents or family members. If you see this happening, you want to immediately take the tooth, put some moisture on it, and stick it right back into the socket. And this is the same thing what I just said as far as replacing the tooth. Make sure you're highlighting information on a splint. Even sometimes after we replace the tooth, we will place a splint to just train that tooth to stay in that position, give the patient some antibiotics, and later on possibly get that child to do a root canal treatment. Now, forms of child abuse, you have to be very careful on how can I put it, on how you receive this, what you say, how you go about it. Now, as far as the dentist and the dental assistant may be put in a position um, observing signs of child abuse and neglect. In some states, the dentist or dental assistant um, may have to, just determine exactly, what's being done. It could be physical, it could be sexual, it could be neglect, it could be an emotional. You want to just, try to gain some paper trail behind this child. And if you see it, you want to bring it to your doctor's attention. You do never, never, never address the patient or the parent about any forms or signs of child abuse. Please highlight this in your book. Now, possible signs um, of abuse. Signs of abuse that the dentist and the dental assistant may observe can consist of a fractured tooth or a fractured jaw, um, lack of patient personal hygiene, dental care, bruises, cuts, burns, if that is inconsistent with any, with any accidental injuries. Now, if we report possible child abuse, now this is if the dentist or the assistant can pretty much, um, report what he or she is possibly experiencing with the patient. Now, um, this would strictly be the dentist's decision. It would not be yours if, if we needed to report any, child abuse or even calling um, Child Protective Service. We want to be able to have proof and things like that, because this could be a very um, hard position to be in, especially if you don't know the facts behind it. You never want to assume. You just want to be very careful. Now, last but not least, um, the dentist must present any type of personal document that they have on the patient or the family, and an explanation behind the given injury. So, for example, doc may say, wow, what happened to your arm? The child could say, well, my mom broke my arm, pulled my arm, and um, hurt it really bad. Sometimes we have to take pictures and, pretty much build a paper trail in order to report it. And that could be the patient, and sometimes they may want the patient personal data, an explanation of the injury, maybe call the physician on, where the patient is being seen, saying, hey, I've been seeing so and so, and have you had this patient? Have you seen this patient? Oh, they came in with a broken arm. Sometimes doctors can get together and try to, they can definitely exchange information, to address the situation. But you never want to assume. I hope here you've learned how to have patience with your patients, understanding, practice the tell, show, do technique, practice that all the time. And if you're going into pediatric, that is an awesome field to be in. And I will be posting questions and videos on this chapter. I hope you enjoyed this lecture, and just let me know if you have any questions. Till next time.